So we have a question here from up in New York City. So Rick, if you can comment, the question is, how do I find a surgeon that can do an artificial disc? And do all spine surgeons do artificial discs?
Well, not all surgeons do the artificial disc, and you're going to have to do a little bit of research. But like any other surgical procedure, you want to go to a spine surgeon who has experience, not just a little experience, a lot of experience, because I think we all know the more you do, the better you get. And it's that way for any type of surgical procedure. So it's going to take a little bit of research. And, I know there's lots of social media areas, but you can also be very frank and honest. If you go to see a spine surgeon, say, hey, do you do a lot of these artificial discs? And if he says, well, I do maybe one a month, that's really not good enough. And then ask him honestly, say, listen, if I was your mother, or I was your sister or brother, who would you go to? Who are the big, artificial disc gurus? And that's what you need to do. I mean, I personally have had a couple surgeries, and I've always gone out of town to the people that had the most experience.
It never hurts to get additional opinions. And I think what COVID has done over the past year, provided us a platform to do telemedicine quite commonly. And I would say once or twice a week, I'm doing telemedicine consultation with patients out of my area who have seen another surgeon and have been offered fusion, and then provide them my honest opinion, whether they're good candidates for artificial disc replacement. If they are, they may ask to either come out and have surgery here in Utah. An alternative would be if I could recommend someone in their area who's perhaps known to me as a colleague who does artificial discs, and that would be another option that I can offer to them. But that's an option that's available to, I think, most of our patients. If they're been told that they need fusion, I always advise them to get at least another one or two opinions and see if they would be good candidates for artificial discs.
And Tom, the other thing is, patients are becoming better and better educated, because as Armin said, I see a lot of patients for second opinion that have been told they needed a fusion. And they said, I was reading about the artificial disc and it doesn't make sense. And they go back to the hip joints and the knee joints. So we see a lot of second opinions, patients seeking the artificial disc too.
Right. I have patients out here in California. They will come in. They are so educated here because they want to live this active lifestyle. And they want to keep mobility. And they'll come in and tell me, Tom, they'll say, I want this particular disc of the 6 discs that are currently on the market and available. They'll say, I prefer to have this specific implant. And, that's how educated people are getting. So they are doing their research, and the internet has been helpful. And as Armin mentioned, with the telemedicine, we're doing a lot of out-of-state consults, and people that are, many times where people are told they have to have a fusion, they're not a candidate. And I look at their films, and I guarantee everybody on this panel, and you're a perfect artificial disc candidate. I don't know what they're talking about. So it's always good to seek out experts who have done lots of these. I recommend skilled surgeons who do many, at least 50 plus, I recommend patients to go to. They can't just go to a guy who dabbles in disc replacement.
Even though artificial disc surgery may sound similar in its technique or its approach to cervical fusion, I think artificial disc surgery is so dependent upon really doing the proper technique and the proper sizing and the proper positioning of the implant so that it functions in a proper way. That is one of the keys to a successful outcome with artificial discs. And in fact, as I've been asked on a number of occasions to review some of the failures of the discs, or I've seen patients in my practice who've had artificial discs done elsewhere, most of the failure doesn't happen because the implant failed. Most of the failures that I see have happened because of inappropriate application of the implant, either in a patient who didn't have the right indications for that particular surgery, or even if they had the right indications, it's just that the surgery itself, from a technical perspective, was not done correctly, that were improperly sized or improperly positioned, and those discs may fail. So I think the experience aspect of doing artificial discs, just like it is true for hip replacements and knee replacement. We keep going back to that. If I needed a hip or knee replacement, I certainly would find a surgeon who has tremendous amount of experience and has good outcomes with that particular procedure, and go have that surgeon do my hip or knee replacement. Same thing applies in the spinal artificial discs.
A fusion is very forgiving, whereas the artificial disc is not forgiving. And that's why you just can't pick it up and say, oh yeah, I can do it. I can do a fusion, because it is much more technically demanding than a fusion. And a lot of factors go into the decision-making, what prosthesis you're going to use, what kind of stability does the patient have, what's their anatomy look like, what's going to be the best fit. And again, position it properly. So with the fusion, it's basically clean the disc out real fast and put whatever fusion device you need and put a plate on. So not that that's simple, and I don't mean to minimize it, for people that do fusion, but doing an artificial disc, particularly in the cervical spine, is much more demanding.
Cervical fusions are a standard operation. They're technically demanding, but they're very forgiving. It's you don't have to be as perfect and precise. Disc replacement surgery needs extreme dedication, skill, and perfection to get the implant in the right place, use the proper implant, and get it to succeed. So it's important for the public to understand that a disc replacement is a harder operation to perform, more technically demanding, but it has a significant reward to the patient at the end when done properly.